Hi guys, welcome to my YouTube channel. I am Aranas, a postgraduate medical intern, and I basically provide informative videos to medical students. And also, I would like to give aspiring Filipino physicians an idea of what a med student usually tackle in med school. If you find these videos helpful, please don't forget to hit the like button and subscribe to my channel and click the notification bell to be updated for my new videos that I'll be posting every week. For today, I'll be discussing the clinicopathologic correlation of coronary artery disease. Coronary artery disease, or CAD, develops when the major blood vessels that supply your heart become damaged or diseased. Cholesterol-containing deposits or plaques in your coronary arteries and inflammation are usually to blame for the CAD. Because coronary artery disease often develops over decades, you might not notice a problem until you have a significant blockage or a heart attack. But you can take steps to prevent and treat coronary artery disease. A healthy lifestyle can make a big impact. That is why it is very important for us to discuss this CPC, for us to give a very good patient education to avoid the risk factors in our patient. I would like to shout out to Karole Cay C. Vargas for helping me in creating this CPC. We'll be discussing each of these sections one by one. So let's start. Here are the important risk factors that we have to consider in patients with CAD. First is the advanced age. Our patient being an elderly are predisposed in having CAD. Also, comorbidities like diabetes mellitus, chronic uncontrolled hypertension are also important comorbidities that we have to manage to be able to prevent CAD. And also, chronic smoking, obesity should also be stopped in these patients because they aggravate further the disease. When all of these risk factors are present in our patient, it increases the likelihood for coronary artery occlusion leading to myocardial ischemia. From there would be loss of functional myocytes, and that would lead to dysfunctional myocardial contractility, thus reducing the cardiac output. And this would be manifested in our patient as dyspnea or difficulty of breathing and easy fatigability. And this now would trigger events, ADH activation, activation, sympathetic nervous system activation, and increased myocardial contractility. Let's go first with antidiuretic hormone activation. This would now stimulate the carotid sinus and aortic arc baroreceptor, and that now would increase the release of antidiuretic hormone, and it would lead to arginine and vasopressin receptor activation. On the other hand, the RAS activation would also increase renin from juxtaglomerular cells in the kidneys. This now would trigger the activation of angiotensin II type 1 receptor, and it would lead to three events. For the adrenal glands, it would cause the release of aldosterone. And as for the blood vessels, this would now trigger peripheral vasoconstriction. And as for the heart, there would be fibroblast activation. Thus, there would be collagen synthesis and hypertrophy. So continuing the ADH activation, it would lead to uh, an increase in water retention from the renal collecting ducts, leading to increased preload and volume overload. This would be further aggravated by the aldosterone released from the adrenal glands, which it could trigger the increase in sodium and water retention in the renal distal tubules, aggravating the volume overload. And this would ultimately lead to systemic and pulmonary congestive symptoms. And what are these? Uh, we could see the jugular venous pressure in our patient to be increased, and also they could have ascites and also edema as congestive symptoms, systemic congestive symptoms. For pulmonary, we would be able to hear RALs in our patient, and our patient could also be complaining of difficulty of breathing. Continuing with the effect in the blood vessels for peripheral vasoconstriction, it would increase the blood pressure of our patient and also the afterload. Thus, it would increase the resistance against the left ventricle, and it would lead to decrease in stroke volume. As for the heart, from the collagen synthesis and uh, hypertrophy, it would lead to adverse left ventricular remodeling, decreasing the cardiac contractility. Moving on with uh, the second event, the third event, the sympathetic nervous system activation, it would trigger the beta 1 receptor, and it would lead to myocyte apoptosis from the calcium overload, further aggravating the adverse left ventricular remodeling. And then the activation of that beta 1 receptor could also lead to difficulty in maintaining cardiac output, thus triggering an increased oxygen demand. This now would further aggravate the myocardial ischemia, and this would be manifested in our patient as angina or chest pain. Aside from the beta 1, alpha 2 receptor is also activated. That activation would further aggravate the peripheral vasoconstriction, leading to more resistance against the left ventricle and further reducing the stroke volume. Moving on now to the last event, the increase in contractility, myocardial contractility, it would increase now the workload, thus stimulating a lot of cell stretching. So the heart would compensate uh, by uh, hypertrophy, and it would be manifested in our patient as cardiomegaly. Okay, I would like to end this presentation by explaining to you this rod of Aranas. We all know the rod of Asclepius. That is a symbol of medicine. Here, I present to you my very own version of it, and I'm proudly naming it as the rod of Aranas. This is a symbol for the four words I treasure. First, Mea Panacea, which means my cure for all. It is shown there as the small silver circle, which I consider as a pill. Second, Raison d'etre stands for my reason for living. This is shown there as the serpent-like silver line, for I will cling to my reasons for living just as tight as a serpent. Third, splagnissimi means my compassionate mercy, represented by the straight silver line, which symbolizes how God sends out his very own compassionate mercy straight down from heaven to all of us. And lastly, magnum opus, which means my life's greatest work, which is shown there as silver infinity symbol, because I will make sure that my masterpiece will last an eternity. That is my rod of Aranas. Thank you for listening and have a good day.